Hi, my name is SONIA WEIRICH. I'm a yoga therapist. Today I wanted to give you a practice for the diaphragm. The diaphragm is a flat muscle, and when at rest, it's domed up in the rib cage, and as we inhale, it flattens out. The diaphragm can get stuck in a certain position and forget its full range of motion. So this practice can help the diaphragm remember its full range of motion and recall that it has this 360-degree movement ability. The practice uses some playground balls. If you're new to this work, I would recommend deflating the playground balls to about 50%. And then as you get used to the work, you can begin inflating the playground ball a little bit more and more. We're going to start releasing the muscles of the neck. You're going to rest the ball at the side of the neck. You're just going to twist the ball around as you gently press in towards the side of the neck. At the throat, you release pressure. And you're just twisting from side to side, helping those neck muscles to let go of their tension so that we can breathe a little better. After about doing this 4 to 5 times, we're going to come onto our side and tune into the ribs and the intercostal muscles. We're going to take the ball underneath, just below the armpit to the upper ribs. And we're going to start with some gentle massage. You can roll from side to side. You can bring in a circular pattern to help the fascia and the muscles relax. And then once you feel like you've gotten a nice little massage, then you can rest your head in a pillow, on your hand, or on blocks. And from here, just allowing the body to soften into the ball. Once you feel like your body has oriented to the ball, you can have a pillow underneath the top arm and rest your top arm on the pillow. Or you can have your hands wrapping around the upper ribs. On the inhalation, you're going to expand into the ball, expand into that upper hand. At the end of your inhalation, engage the muscles between the hand and the ball a little bit more, as if you're trying to push the ball away from you, push your hand away from you. And then slowly as you can, you're going to exhale, release. At the end of your exhalation, you're going to pause for a count of 1 or 2 as the ribs hug in. On the inhalation, slowly expanding into the ball, into that top hand. At the end of your inhalation, for a count of 1 or 2, you expand a little bit more. You tighten up those muscles a little bit more. And then as slowly as you can, hugging the ribs in towards one another. At the end of your exhalation, pause for a count of 1 or 2 as the diaphragm is doming up. You're going to do that 4 to 5 times. After doing that 4 to 5 times, you're going to move to the low ribs. And at the low rib level, you're going to, once again, do a little massage. You can have your head resting on a pillow or supported by your hand. Massaging around, you can go in a circular pattern. And then resting down onto the ball, onto the low rib level. You can have your head resting on a pillow or a block. And just allow the body to soften into the ball here, orient to the ball. And then you can wrap your hands around your low ribs or have a pillow there, resting the arm on top. And on the inhalation, you're going to breathe into that low rib area, expanding the hand away from the ball. Pausing at the end of your inhalation, tighten the muscles between the hand and the ball. And then as slowly as you can exhale, hugging the hand and the hand towards the ball towards the hand. And pause at the end of your exhalation for a count of 1 or 2 where the diaphragm's domed up. And then repeating this, slowly inhaling, expanding the hand away from the ball away from the hand. The end of your inhalation for a count of 1 or 2, tighten the muscles between the ball and the hand. And then as slowly as you can, release that tension, hugging the low ribs in and up. At the end of the exhalation, pause for a count of 1 or 2 where the diaphragm's domed up. And doing that 4 to 5 times. And then moving to the waist, taking the ball between the ribs and the waist and doing that little bit of massage, moving from side to side, front to back, bringing in circular movement as well. And then resting with the ball at the waist. Top hands can be on your waist or just down alongside you. On the inhalation, you're going to expand into the ball, expand into that top hand. At the end of your inhalation, tighten the muscles between the hand and the ball. And then as slowly as you can, exhaling, releasing that tension. At the end of your exhalation, just melt over the ball for a count of 1 or 2. And then beginning again, inhaling, expanding. So you're pushing the ball away from you, expanding out into the upper hand at the end of the inhalation. Tighten the muscles between the hand and the ball. And then slowly relaxing on the exhalation. At the end of your exhalation, just allow everything to melt for a count of 1 or 2. And then from here, we're going to move over onto our belly, but at home, make sure you do the other side. But for the sake of the video, we're going to come onto the belly. And here, I like the smaller ball, placing it in between this, on the sternum, the breastbone. And here we can start out with that little massage, rolling from side to side, bringing in a circular pattern. And then resting with the head supported by a pillow or your hands. And allow the body to soften over that ball. And then as you're ready, on an inhalation, expanding into the ball. As you expand out through the upper back, at the end of your inhalation, push in towards the ball or tighten the muscles above that ball area. For a count of 1 or 2, and then on the exhalation, just allow everything to melt over the ball. At the end of your exhalation, just rest in that melted position for a count of 1 or 2. And then beginning again, inhaling, breathing into the ball, expanding out to the upper back. At the end of your inhalation, push the ball away from you. And then as slowly as you can, exhaling, releasing. At the end of your exhalation, pause in that relaxed position for a count of 1 or 2. Doing that 4 to 5 times. And then now you're moving the ball to the xiphoid process, where the kind of that arch, where the low ribs come towards one another, that upper arch area. And from here, you can start with that gentle massage. And bring in some circular movement. And then resting over the ball, head supported by a pillow or your hands. And then on an inhalation, breathing into the ball. Holding at the end of your inhalation, you're going to try to push the ball away from you. And then as slowly as you can, releasing that tension as you exhale. At the end of your exhalation, pausing in that relaxed position for a count of 1 or 2. And then beginning again, inhaling, pressing into the ball. Holding as you push the ball away from you. And then very slowly exhaling, releasing that tension and pausing for a count of 1 or 2. Doing that 4 to 5 times. And then from there, we're going to move down to the belly, placing the ball on the navel area. And from here, you can start out with that gentle massage. Rolling from side to side, bringing in circular movement. You want to avoid any sharp pain. If you feel sharp pain, take the ball out or deflate the air. And you can do all of these practices without the ball. Just lying on your side, lying on your belly. So from here, softening over the ball. And when you feel the body has adjusted to the ball on an inhalation, you're going to breathe or expand into the ball. At the end of the inhalation, push the ball away from you a little bit more for a count of 1 or 2. And then as slowly as you can, you're going to release that tension on the exhalation. At the end of the exhalation, pause for a count of 1 or 2 as you melt over the ball. And then beginning again, inhaling, expanding into the ball. Pausing for a count of 1 or 2. And then exhaling, releasing. Slowly at the end of the exhalation, pausing for a count of 1 or 2. Doing that 4 to 5 times. And then we're going to move lower. We're going to take the ball just above the pubic bone. And the diaphragm acts like a piston between the thoracic and the abdominal cavity, moving up and down. And that's why we got into those belly muscles. And the diaphragm also works with the pelvic floor. When we inhale, the diaphragm flattens out, the pelvic floor relaxes. And as we exhale, the diaphragm domes up and the pelvic floor closes like the petals of a flower closing in and up. So after you give yourself a little massage there, resting over the ball. Once you feel your body has oriented to that ball, that pressure, on an inhalation, breathing into the ball. At the end of your inhalation, see about pushing the ball away from you. And then relaxing as slowly as you can on the exhalation. At the end of the exhalation, pause for a count of 1 or 2 as you melt over the ball. And continuing again, inhaling, expanding, breathing into the ball. At the end of your inhalation, engage those muscles. And then as slowly as you can, releasing. And then pausing in that relaxed position for a count of 1 or 2. And doing that 4 to 5 times. And then from here, now we're going to make our way onto our back and we're going to move into a more relaxing practice. So on your back, we're going to take the ball in between the shoulder blades. And with the ball resting in between the shoulder blades, you can do some gentle massage, rocking from side to side. You can bring in some circular movement. And then you can rest with your chest resting over the ball, relaxing into what you feel there. And then you can see about engaging a more relaxing breath here. We're going to simply allow the body to inhale until you feel a sense of fullness. Pause for a count of 1 or 2. And then exhaling, melting over the ball, softening down. And pausing until you feel the need to inhale. When you feel the need to inhale, breathing into the ball until you feel full. And then slowly releasing. At the end of your exhalation, you're going to relax, listen, and wait for the need to inhale. You're going to do that 4 to 5 times. And then take the ball about 2 inches down, more to the bra level area, the bra line area. And from here, doing that same kind of breathing. On an inhalation, allow the body to expand, breathing into the ball. At the end of the inhalation, pause for a count of 1 or 2. And then as slowly as you can, releasing the exhalation. The end of the exhalation, pause, listen, wait until you feel the need, the urge to inhale. And then beginning again. Doing that 4 to 5 times. And then from here, we're going to move the ball down to the low back area, the sacrum area, placing the bigger ball underneath the sacrum. And from here, you can do that gentle massage, going from side to side, circling around. And you could do that gentle massage at the broad line level. I forgot to add that in. And after a little massage, you can pause there. Allow your body to orient to the ball. And then the same breathing practice here. On the inhalation, expanding into the ball. And the exhalation, softening and relaxing until you feel the next need to inhale. And then slowly allow the body to expand. Pausing for a count of 1 or 2 at the end of the inhalation. And then slowly exhaling. At the end of your exhalation, you're going to wait until the body tells you it needs to inhale, and then inhale. Doing that 4 to 5 times. And then after that practice, you can draw the knees into the chest. Just release the low back with some knees to chest. And we're rocking from side to side. Making your way onto your side. And coming up. And that includes a little practice for your diaphragm. If you have any questions about that practice or want to tailor it to your own needs, please schedule a yoga therapy session with me and we can customize this practice for you.